Let me give you an example. A debridement, the physician is going to remove the necrotized tissue and the devitalized tissue till the muscle fascia, and the wound measures 60 square centimeter. So what would be your coding? So here we can report as 11043 and 11046 times 2, because 20 for the first 20 square centimeter, 43 for the first 20 square centimeter, and a 46 for the next 20 square centimeter, and the remaining 20 would be the 11046. So is that clear? Lastly, I want to mention that the doctor is going to do a debridement, and that debridement takes place from the subcutaneous muscle on the bone. When he is doing a debridement of the bone, he naturally has to perform the subcutaneous or the hypodermis debridement, then the muscle fascia, and then the bone debridement. So, as the levels of debridement go higher, the other debridement are usually bundled, right? So, for example, when you are going to do a muscle debridement, that naturally includes a debridement at the subcutaneous level. So, when you are coding for 11043, 11042 is bundled, it is included. Now, here you have a scenario where the provider has reported 11043 and a 11042 and the coding is correct. How can this be correct? This can be correct when the patient has two different wounds and the provider has treated or debrided the two different wounds. First wound till the muscle level and the second wound on the subcutaneous level. I hope this is clear. Next topic is like in debridement. Within debridement, we have debridement of open fractures. Because open fractures, the skin gets exposed, the bony fragments can be seen, and we have specific code sets for debridement of open fractures. I hope debridement is pretty easy. Put one primary code, put one add-on code, see if it is getting bundled. Unless there are different wounds, you cannot report separately while doing a debridement of the bone.